8:35, everybody. In New York City, suspected child abuse reports are significantly higher among Black and Latino children, and the real story behind those numbers reveals an even bigger issue, which is the lack of support for families in need of help.
The Administration for Children's Services is legally required to investigate every single report that's made, and a majority of them are in the Bronx. April is Child Abuse Awareness Month, so joining us this morning is ACS Commissioner Jess Dannhauser to discuss what the agency is doing right now to prevent families from getting caught up in the system. So good morning to you, Commissioner Dannhauser. Appreciate you coming in.
Good morning, Hazel. Lovely to be with you and Dan.
Good morning.
So there is a very long-standing perception that ACS caseworkers are completely overloaded. Is that just a perception? Is that the reality? Because how many caseworkers do you actually have, and how many cases per caseworker?
We have about 1,000 child protective specialists, mostly women of color who do an extraordinary job day in and day out. Currently, their caseload is about 9, which is well below the national standard and the state standard of 12. The city has made a concerted effort to make sure we continue to hire child protective specialists.
Let's talk about this class action lawsuit. It was filed in Brooklyn last February over how caseworkers handle investigations of child abuse and neglect. And it also cited a lack of training for those caseworkers. I'm sure you're very well aware of the lawsuit. So where does it stand, and what is your, reaction to that lawsuit? Is there a substance to it?
So taking a step back and starting with the fact that it is 7 times more likely that a Black child's family is called into the child abuse hotline at the state level than a white child's family, and 5 times more likely that a Hispanic child's family is called in to a white child's family. We are taking this seriously. This is something I came into the administration to make sure we were addressing. What we are doing is retraining all of mandated reporters. They work at schools, they work at hospitals, they work at shelters, to make sure they understand what is going on in the totality of those calls, to make sure they know pathways to help. We have a plethora of prevention services. 15,000 families can be served at any given time through ACS prevention services. We're getting out child care. When we started, there was less than 7,000 children enrolled with subsidized child care. Now there's over 35,000. So the mayor is calling us to go upstream. That's why we're doing this work. We take it very seriously. As it relates to the work of child protective specialists, we've been training them to make sure they follow families' rights for years. Last year, we decided to take a step further. We listened to parents, we listened to advocates, and we are now at the front door telling families what their rights are, that they have a right not to let us in that moment, that they have a right to call an attorney at any time during an investigation. These are staggering statistics, and they animate our work every single day.
What is the time frame from the time somebody makes a call to when you're actually there and helping a family?
Depending on the timing of the report, it's between 24 and 48 hours. We've also launched a new program over the last few years called CARES, where the state gives us authority to respond not in an investigation, but with services. We actually call the families first in those instances, set up a time to come in, develop a solution-oriented plan with the family, and we're in 1 in 4 cases, we're responding now with the CARES approach.
So you talked about some of the disparities, right? Can you give us some examples of how ACS is working to combat the racial disparity that exists, especially along low-income communities versus some of the wealthier neighborhoods that we see in New York City?
The key is to start at that first call, to make sure that someone that's concerned about a child, if they think the family is just struggling, there's no need for a report in the first place. Call us for services.
Struggling financially?
Struggling financially, could be having trouble getting their children to school on time, might be in need of particular supports around substance abuse or mental illness. If the family is really trying, what we can do is set up services for them. We have community-based organizations in every neighborhood throughout the city. That's how we want to respond to families in the first instance, and have our child protective specialists really be focusing on where children are in danger. They don't need to be going out for families who just need a little bit of help. That is why we have prevention services. That's why there's a plethora of community-based organizations. We're launching new family enrichment centers. We now have 12 open, and are going to be opening 30 across the city. So this upstream approach is really motivating all of our work.
And just real quickly, if you are, whether you're a family in need or maybe you're a neighbor that thinks that there's a family in need, what's the first step that they can do to reach out to your agency?
If you're a family, if you're a neighbor, if you're a teacher, the first thing I would say is go to our website, www.nyc.gov/for families, or call 212-676-7667. And that we'll have folks who respond very quickly and make sure they're connected to local community-based organizations that can meet their needs.
All right, good work that you're doing there. Appreciate your time this morning. I know we're out of time, but it is great to have you here, Commissioner.
Thanks, Dan. Thank you, guys.